Understanding the impact of saturated fats on heart health, insights from recent research. Recent findings in the field of nutrition have sparked both interest and controversy regarding the role of saturated fats in causing cardiovascular disease. And this is the part most people overlook: how does current scientific evidence truly inform our dietary guidelines? A comprehensive systematic review published on December 15, 2025, in the Annals of Internal Medicine brings new perspectives to this ongoing debate, analyzing the relationship between saturated fat consumption and the incidence of heart-related events. Professor Tom Sanders, a distinguished figure in nutrition and dietetics from King's College London, offered his expert analysis of this study. He notes that the review re-examined data from randomized controlled trials, RCTs, focusing on reduced saturated fat intake and its effect on cardiovascular mortality. While the overall trend indicated that lowering saturated fats might decrease the risk of cardiovascular death, the results did not reach statistical significance across the board. Interestingly, among individuals classified as high risk, replacing saturated fats with polyunsaturated fats showed a clear, statistically significant benefit. Conversely, no definitive effects were observed in those considered at low risk. Professor Sanders also pointed out several limitations of the review which are crucial for understanding its implications. Most of the original research was conducted between the 1960s and 1970s, primarily in the USA, Europe, and Australia. During that era, average saturated fat intake was considerably higher, around 18 to 20% of total food energy, compared to the 11 to 13% people typically consume today. Many of these older studies featured relatively small sample sizes, often fewer than 1,000 participants, mainly involving individuals already diagnosed with cardiovascular disease, who are inherently at greater risk. To confidently detect a benefit in the general population, studies need to include a much larger number of participants. The Women's Health Initiative, involving nearly 30,000 women, was the only study with enough statistical power. Interestingly, this trial focused on a low-fat diet to prevent breast cancer, not specifically on reducing saturated fat, and found no significant impact on cardiovascular mortality. Moreover, similar robust studies for men are lacking. The criteria used to define a high risk in the review were based solely on previous cardiovascular events, without incorporating modern risk assessment tools like CRISC-3. This distinction matters because individuals without a history of a cardiovascular incident can still be at high risk, especially as age increases, highlighting the importance of nuanced risk evaluation. So, what does this mean for everyday dietary advice? Universally, public health policies aim to lower average cholesterol levels, specifically non-HDL cholesterol, since reducing this marker slows the development of atherosclerosis, plaque buildup in arteries, and diminishes the overall population risk of heart disease. Over the past 5 decades, many countries, including the UK, have significantly decreased saturated fat consumption, from about 20% of energy intake in the 1970s down to roughly 13% today, and this reduction correlates with notable declines in non-HDL cholesterol levels. Much of this positive change predated the widespread use of statins, suggesting that dietary modifications alone contributed substantially. For high-risk individuals, medications like statins are far more effective at lowering harmful cholesterol forms than diet alone. Still, maintaining a diet low in saturated fats offers additional cardiovascular protection for the entire population, a principle that supports broader public health strategies. The study titled, Effective Interventions Aimed at Reducing or Modifying Saturated Fat Intake on Cholesterol, Mortality, and Major Cardiovascular Events, authored by Jeremy P. Steen and colleagues, provides valuable insights and was published in the same journal, marking a significant milestone in nutritional research. Disclosing potential conflicts of interest, Professor Sanders mentions associations with organizations such as Heart UK and the Malaysian Palm Oil Board. His career has included research funding, consultancy roles for companies related to artificial sweeteners, sugar substitutes, and palm oil, as well as positions on advisory committees involving food industry stakeholders. These connections are common among researchers but highlight the importance of transparency in scientific discourse. In conclusion, while reducing saturated fat intake can be one piece of the complex puzzle of heart disease prevention, its role should be considered alongside other strategies, including medication, lifestyle changes, and personalized risk assessment. Do you think current dietary guidelines adequately reflect this nuanced view, or are they still overly simplistic? Share your thoughts below. This debate is far from over.